A very good evening to all of you. Today we are going to do dermatology. So let us begin with the first question. Fox or Dicey disease affects A. Sebaceous glands, B. Acrine glands, C. Apocrine glands, D. Endocrine glands. Any gland. It is apocrine gland. Fox-Fowler disease, also called apocrine malaria, is a rare, chronic inflammatory skin disorder affecting the apocrine gland. It presents with pruritic papular eruption, primarily in areas rich in apocrine glands such as axilla, areola, and genital region. So it is apocrine glands. Which of the following is the most common form of malignant melanoma? A. Nodular, B. Superficial spreading, C. Acral lentiginous, D. Mucosal. It is superficial spreading. Lines of Blaschko represent A. Lines along lymphatics, B. Lines along blood vessels, C. Lines along nerves, D. Lines of development. These lines of Blaschko are the lines of development. The lines of Blaschko are defined by a pattern determined by nevoid, representing non-random lines on the human skin or mucosa. The Blaschko lines or the lines of Blaschko are thought to represent pathways of epidermal cell migration and proliferation during development of fetus. Lines of Blaschko represent non-random developmental lines of the skin, fundamentally differing from the system of dermatomes. So the correct answer here is lines of development. Pemphigus vulgaris is characterized by all positive Nikolsky sign, oral erosion, subepidermal bulla, Young smear showing acantholytic cells, except subepidermal bulla. Pemphigus vulgaris is an intraepidermal blistering disease. All are features of atopic dermatitis: Denny-Morgan fold, Hartog sign, Darrier sign, hyperlinearity of palms, except Darrier sign. Koebner phenomenon is seen in A. psoriasis, B. lichen planus, C. warts, D. all of the above. Heliotrope sign is seen in A. dermatomyositis, B. scleroderma, C. photodermatitis, vitiligo. It is dermatomyositis. Erythema is caused by A. Corynebacterium, B. Staphylococcus, C. Streptococcus, herpes virus. It is Corynebacterium. Christmas tree appearance is seen in A. Pityriasis rosea, Pityriasis rubra pilaris, psoriasis, vitiligo. It is Pityriasis rosea. Pharynx affects A. palm and sole, B. groin, C. scalp, D. trunk. It is palm and soles. Click the link in the description to join the 3-day Ultimate Neet PG Breakthrough Blueprint event. HPV causes A. condyloma lata, B. condyloma acuminata, C. bubo, D. chancre. It is condyloma lata. Nail pitting is seen with A. paronychia, B. ectodermal dysplasia, C. alopecia areata, D. all of them. It is all of them. Vitiligo is associated with the following: Addison's disease, Men's syndrome, pernicious anemia, Crohn's disease, except Crohn's disease. Hashimoto's cells in epidermis are responsible for A. touch, B. temperature, C. pressure, D. proprioception. It is touch. Apple jelly nodule is seen in A. lupus vulgaris, C. B. cutaneous anaphylaxis, C. erythroderma erysipelas. It is lupus vulgaris. True about lesions of lichen planus, polygonal violaceous pupule, affect skin and mucous membrane, are pruritic, all of them. In fact, they are all of them. D. Color of tuberous sclerosis lesion on wood lamp examination. This is most often asked question. A. bright green, B. milky white, C. golden yellow, D. blue white. It is milky blue white. Alopecia areata is a autoimmune disorder, allergic disorder, anaphylactic disorder, bacterial infection. It is an autoimmune disorder. Whitefield ointment consists of 3% salicylic acid plus 6% benzoic acid. Yeah. Urinary retention earliest in pregnancy is seen at year 10 weeks, 18 weeks, 22 weeks, 34 weeks. It is 10 weeks. Spaghetti and meatball appearance is seen in A. pityriasis rosea, B. tinea capitis, C. tinea corporis, D. tinea versicolare. It is tinea versicolare. Tinea versicolare or pityriasis versicolare is a misnomer as it is not caused by a dermatophyte. It is caused by a non-dermatophytic fungus called Pittosporum ovale, also called Malassezia purpur. Usually affects young adult. Clinical features are multiple, scaly, pigmented, hypopigmented (more common) or hyperpigmented macule. Scaling is furfuraceous like rice-like powder. Macules start around the hair follicle and they merge with each other to form large areas. Affect trunk and shoulder. There may be loosening of scales with fingers, nails. So it is tinea versicolare. Miliary arises from obstruction of A. eccrine wetland, apocrine wetland, sebaceous gland. It is eccrine wetland. Black Petra is caused by Petra horti, Trichospora masahi, Trichospora ovans, Trichospora nigra. It is Petra horti. Onychomycosis is most commonly caused by Trichophyton rubrum, Trichophyton mentagrophyte, Epidermophyton focosum, Trichophyton rubrum. RAS test is used to diagnosis of allergic dermatitis, seborrheic dermatitis, mycosis fungoides is allergic dermatitis. True about pemphigus vulgaris, all subepidermal autoimmune disease, Janksmere shows acantholytic cells. Antibody are formed. It is subepidermal. A girl about Mary has comedonal and drug to treat is just give retinoids. Depigmenting agent of choice in treatment of dermatological disorder. Hydroxyquinone, zinc, kojic acid, azelaic acid. It is hydroxyquinone. Vitiligo is associated with all. Addison's disease, Men's syndrome, pernicious anemia, Crohn's disease, except Crohn's disease. Sex worker with discharging ulcer, gram-negative diplococci and growth unmodified hair matter. Diagnosis is Neisseria gonorrhoeae, syphilis, LGV, chancroid. It is Neisseria gonorrhoeae. Lavevoint profile sign is seen in A. koilonychia, platynachia, clubbing, onycholysis. It is clubbing. Hanifin-Rajki is a diagnostic criteria for atopic dermatitis, contact dermatitis, urticaria, erythroderma. Atopic dermatitis. Spongiosis involves stratum basale, stratum corneum, stratum granulosum, stratum spinosum. It is stratum spinosum. Schamberg purpura are seen in face, feet, chest, arm, feet. Matchstick test is positive in A. rhinophyma, rhinosporiasis, lupus vulgaris, versicolor. Lupus vulgaris. Voronoff's ring is a feature of A. psoriasis, B. lichen planus, pityriasis rosea, pemphigus. It is a feature of psoriasis. Clinical feature of psoriasis. Psoriasis occurs at all age. Most patients are young or middle-aged male. Typical lesion is nummular round plaque which has following cut. Well-defined, profuse, silvery white, powdery skin. Loosely adherent, easily drops. Bright red erythematous beige. Plaque is often surrounded by hypopigmented halum moronum. This is psoriasis. Volcanosine is seen in A. leprosy, leishmaniasis, lupus vulgaris, DLA. It is leishmaniasis.